HER2CLIMB trial overall enrolled approximately 600 patients, and of these, 291 patients had brain metastases at study baseline. So that's about half of the patients enrolled on the trial. Again, a very unique feature of this clinical trial. Of those patients, 60% actually had new or active brain metastases on study entry, so that's very unique to this study. And what we looked at in this analysis was the outcomes of patients with brain metastases enrolled on HER2CLIMB by randomized arm. What we found is that from the standpoint of intracranial response rate, that it was higher with the triplet, and it was around half of patients achieving a CNS partial response or better, compared to about 20% in patients receiving trastuzumab, capecitabine, and placebo. More importantly, we found that there was a prolongation of an endpoint called CNS progression-free survival, defined as time from randomization until CNS progression or death. And we found this was significantly reduced by about 2/3 with the tucatinib, and this translated into about a 5-month absolute improvement in median time to CNS progression or death. And finally, we found that there was a significant improvement in overall survival with the use of the triplet in the brain metastasis population, and that corresponded to a hazard ratio of 0.58, and that translated into an approximately 6-month absolute improvement in median overall survival for this very difficult to treat patient population.